Hi, I'm Dr. Rudy Kachmann. Welcome to this show. This will be mainly about stopping, preventing, reversing type 2 diabetes. To me, this is a critical subject and very well may be in your life or someone in your family. To me, this is a wonderful opportunity to get rid of type 2 diabetes, which I feel if you can do 90% of the time within about a month. It's not promoted by the government. Why? I don't know. Maybe because industry gives them a lot of money. Generally, I find providers are not screening patients early enough so they could catch type 2 diabetes maybe 15 years on its path. What most patients, and I don't expect them to know, and providers aren't telling you, and I don't think they do it on purpose. I think it's lack of knowledge that the 30, 50 complications of type 2 diabetes can occur in pre-diabetes. You can have unannounced heart attacks, no angina, you just fall over and you're dead. Yeah, you read around the paper, maybe you've had friends, and the reason is they don't have angina. The first symptom of heart diseases, they drop over. And I'm trying to stop that, prevent it, and reverse type 2 diabetes, which you could do in about a month, 90% of the time. I'm going to teach you how to do it. This is wonderful news. It's based on many books. I can give you 10 books, 10 different DVDs, and maybe more scientific proof of exactly what I'm saying. I'll just hold up a few good books to read. I've written one, actually. I'm not holding that one up here today, but look at Amazon Books, Kachmann. The fraud of type 2 diabetes. It's a fraud. If they act on it and get rid of it, you're rid of the disease. We can't continue to let you have it and die from it. If you get type 2 diabetes, you will live 25 years less on average, and you will, 35 of those years, you'll have some disability. Come on, we don't want that. I can prevent that, okay? Here's a great book, End of Diabetes by Dr. Joel Fuhrmann, my friend Dr. Joel Fuhrmann. I've gone to his seminars all over the country. You see him on Dr. Oz, different shows. End of Diabetes. Another one I don't have with me today is Goodbye Diabetes by Dr. Wes Youngberg. He went to the island of Guam, where 99% of the natives have become diabetic because they ate American food. He was there 15 years, get rid of most of diabetes. His method of testing, which you can get a copy of by attending one of my lectures or seminars, say at Lutheran Hospital. I'm having one next Wednesday at 7. You can cashmanhealth.com. The dates are on there. The method of testing that he uses is being done at Kaiser Permanente now, so he's getting somewhere. I've tried to get people to change in this town the way they test for prediabetes, but it's been an impossible task. Public health is not interested. And the thing I'm promoting is a glucose tolerance test with fasting blood sugar. Fasting, 1 hour, 2 hour. And serum insulins. And we catch diabetes probably 15 years before it occurs. Metabolic syndrome is another waist measurement. If you got a pot belly, you're probably pre-diabetic or diabetic. And you say, oh, I'm not because they tested my blood. Well, I tell you something, they ran the wrong test. Yeah. Odds of being pre-diabetic or diabetic if you get a big belly is high. This is a judgment-free zone. I'm just trying to save your life, avoid disabilities. What are the disabilities of type 2 diabetes? Unannounced heart attacks, dementia, memory loss. The biggest cause of memory loss in people's lives is type 2 diabetes. You can call it Alzheimer's disease or plain old dementia, but 75% of the cases of dementia can be totally avoided by exercising, proper diet, and by exercising I mean maybe you take a walk and eat nutrient-dense food. Not a diet, just a way of eating, maybe a couple of supplements, that's about it. You can avoid most of dementia, horrible problem. Blindness, retinal disease. I had a friend of mine I played tennis with, it lost a bunch of vision in his eye from pre-diabetes, cataracts, all related to blood sugar, gum disease, teeth disease, unannounced heart attacks, heart disease, vascular disease, strokes, dementia, renal transplants, liver transplants, skin diseases, all neuropathy of the stomach, can't digest anything because all the nerves became dead in the stomach, acid reflux. All can be caused by type 2 diabetes, all can be prevented, stopped, and reversed by proper lifestyle. Yeah, and you have to act on this. And I can name many other books. Mark Hyman's books, Blood Sugar Solutions, excellent book. He also recommends a method of testing with the serum insulin and the fasting blood sugars. That's right out of his books. Wes Youngberg, the other gentleman I mentioned, starts with increasing blood sugars, testing it frequently, and watching the path and keeping track. Put on a computer or write them down. For example, when the president was running in the primary, it said he weighed 232 and his blood sugar was 99. Well, according to Dr. Fuhrmann and Wes Youngberg, that's pre-diabetes. Okay, all right. And the most recent testing, I noticed they didn't mention the serum insulins, they didn't mention the blood sugar number, and they did not mention the HbA1c number. They said, oh, it's normal. Well, what do they think is normal? I don't know. Maybe it is. Let's hope it is. We can all give them a big hug, but I'm concerned that may not be accurate. So, but I'm most concerned about you. Get the proper blood testing. So to read those books I mentioned, I think it's great. Another great book came out recently, The Case Against Sugar by Gary Taubes. I recommend it highly. One of the interesting chapters in there, which I didn't know, I mean, I don't smoke, but cigarettes got sugar in them. Yeah, I didn't know that. Never speak to another person since then. Even doctors did not know there's sugar in cigarettes. And the reason is that smoke is alkaline. It makes you cough, so people can't get addicted because they cough. That was 1910. They couldn't addict enough people. So then they found out if they combined Virginia tobacco with Kentucky tobacco, Kentucky tobacco has holes in the leaves. And after curing it for a week, they can put it in molasses and sugar and honey and get sugar into the leaf. That your blood becomes acidic, opens your alveoli up, and allows the nicotine and the chemicals in to turn you into an addict. Yeah, that's true. Gary Taubes, The Case Against Sugar. Read the one on cigarettes. Alone, no less. And they're deciding that sugar is the booger and the hooker. It's not the fat. They're bad fats, the omega-6 fats. But and the reason we developed type 2 diabetes, that 75% of the people are overweight, okay, judgment-free zone, but 25% are what we call the trophies, thin on the outside, but fat on the inside, fat on the liver. They're called the trophies. So you're not quite what you eat. You're not quite what you digest. You are what your blood work is. Yearly blood work starting at age 2. No one else recommends that. I'm saying that because we have so many type 2 diabetics, age 6, 7, teenagers. Most of them die from heart attacks and strokes in their 30s and their 40s. Yeah, when you read in the newspaper, they died in their 40s and 50s. What's the odds are? Odds are it was something related to type 2 diabetes and the complications, which can be avoided. It's a great, and it's not hard. Did I say diet? No. Eat 70, 80% foods of color. You can add some mushrooms. You can add some onions. 20% meat at most, and maybe some turkey. I tell you, even chicken, they say it's healthy. It's 40% fat, and it's animal meat, and they get nitrosamines in them and chemicals in them, and they're not healthy, but you might get away with 20% if you just absolutely can't stop eating meat. I eat a little bit of meat, but not very much. I know what they do to the animals. I read about it, and then I saw a Doodle's movie on the animals, and there was a couple of songs in there, and I looked in her eye. Okay, another song was called "The Vegetarian." You're lucky I'm not singing them to you, because I am going to memorize them, and maybe sing it at one of the lectures. If you have trouble stopping eating the animals, you might think, what do they do to them to put on your plate? Most of us, I know you would not have the heart, to do that. But all these sudden heart attacks, they come to the emergency room and they had a heart attack. Oh, you're diabetic. They run blood tests. They've never been properly screened. No serum insulins. We need to screen people proper. And your doctor said, well, you get a blood sugar, it's normal, I'm fine. Baloney, okay? If you're overweight, you got a pot belly, your belly measurement is up, you're pre-diabetic. So we want to catch you on the path to diabetes. And what's on the path? Well, maybe you're overweight, or maybe you're a TOFI. Your triglycerides could be elevated. That can be the beginning. Metabolic syndrome is called Syndrome X. X is at the middle, and they have about 7 factors that make it. If you get 3 or 4 of those, you may be pre-diabetic, which would be belly measurement, high blood pressure, HDL, the good cholesterol is too low. Your LDL is too high, 75 or under should be it. Some might say 100, but I say 75. And the triglycerides we spoke about, and your blood sugar, and they determine whether you have insulin resistance. That's where insulin can get the sugar into the cells to make energy, and people will have it all over the body, in the muscles and the brain cells, and that's results in type 2 diabetes, where the insulin level is elevated. Type 1, which is maybe 1.6 million, there the pancreas died from autoimmune disease. Some people can get it from drinking milk. Read Whitewash by Keon. I doubt you'll drink milk again. Read it. I'm not going to tell you not to do it, but read it. I put almond milk in my coffee, and very, very interesting. So you can prevent it. Now, suppose you have type 2 diabetes. You're listening to me today. Don't throw in the towel, because I don't want you to get these complications. And Dr. Fuhrmann would say, Dr. Youngberg would say, Dr. Mark Hyman would say that, and check with your doctor, okay, because you may need to stop your medications pretty quick. I didn't say to stop them, okay? But Franklin House wrote a book called The 30-Day Miracle. All books that describe this in great detail. But check with your doctor, check your blood more frequently, know the symptoms of too high blood sugar and too low blood sugar. You got to know those symptoms. You start eating right. On the DVD of Dr. Mike Hyman, he would say your blood sugar probably normal in a week, most of the time. Wow, a week. Yes, that's the reason you got to check more frequently. Tell your doctor that you're going to eat 80% nutrient-dense food, fruits of color, add some mushrooms, add some onions, make just a little bit of meat. You're going to exercise a little bit, maybe take a walk, okay? That improves insulin resistance. And if you want to up that a little bit, you can walk a little faster, walk a little slower. I looked up on the internet, and I'm doing it now a little bit, something called race walk. Just instinct. It's just walking, just maybe a little bit faster, and that's kind of instinct. I didn't say you need to run marathons, maybe lift some light weights at best. So the amount of exercise isn't huge. It's about 20% exercise. 80% will be the type of food you're eating. You say, oh, it's in my genes. Well, it's in your genes, all right. It's in your genes, all right. But I tell you, I saw a family at a tabanaki table recently, and from little grandchildren to little kids and big kids, and everybody was significantly overweight, and you might say it's in their genes. I watch them eat. They're all eating their own food, okay? It's a judgment-free zone. They don't know better. No doctor was ever passionate and saw them back frequently, or provider, to tell them how to get rid of it. It's just the script. Here's your metformin, see you later. Instead of getting rid of your disease and maybe using metformin in the meantime, that's fine. I'm not against medication, but I'm for pushing to get rid of our disease. We're eating so much processed food today. They don't have any vitamins, minerals, phytochemicals in them in these fast food restaurants. And the government supports the price of sugar. You wouldn't believe it, yeah. The sugar industry bribes them, and they accept the money. The sugar associations, it's fake news. It's fake news. You got to pay attention. What the government FDA puts out there, a lot of it is fake news. If they were serious about that, they stop all lobbying on the sugar, for example. That makes no sense. In corn, high fructose corn syrup, you got to read the labels to get rid of that. That helps form diabetes. And the Japanese discovered an enzyme to convert corn into sugar, the high fructose corn syrup, make it real cheap. So these companies can buy it real cheap, and the labeling of that is not quite right. So you got to read labels. Preferably, don't eat any food that has a label on it. Just eat fresh food. It's full of fiber. Let me give you an example. If you decide, boy, I could get rid of my diabetes, like Dr. Kachmann says, and I want to change, let me show you an easy way to do it. If this is your calorie burn, say, in a day, okay? In a day, this high. 40% is basic metabolic rate. That's the energy taken up by your brain, your heart, your lungs, your muscles, doing nothing, BMR, okay? It's hard to change that. That's 30-40% if your total calorie burn for the day. 20-30% is the energy of your food, and I'll tell you about that in a minute. And the 30% or so is what I call activity of living. That's a term I invented. Activity of living. Well, what does that involve? That's why you see now treadmill desks, stand-up desks, things like that. People in their offices, they can stand up while they're working. They can do that for a few hours. That increases their calorie burn. If you increase your calorie burn, say 200 calories a day, divide that into 365 days, 3,500 calories a gram, you could lose 20 pounds. 200 calories a day of increased activity, 20 pounds in a year. How hard is it to get rid of your diabetes if you have a hard time doing it any other way? Odds are you will not exercise it away. That's 20% at best. It's good for you. That improves, reduces insulin resistance. I want you to exercise your body and your mind, but the type of food you eat is the crux of it. You eat meat 7 days a week and having all kind of donuts, you're going to be guaranteed to be a diabetic. If you're, suppose you eat out twice a day, like a lot of successful people do, and I know many of them in this city, the multi-millionaires, but many of them are unhealthy. Yeah, they're blind to it, blind, because I talk to them. They're intelligent people, but they think they're stressed out from work. Stress causes increased eating. Believe me, if they're doing true TV shows or some other things I'm doing, and there's a donut laying in the kitchen on my home when I come home, say at 9 o'clock tonight, guarantee you I'll be eating it. And that goes to, at 135 pounds, I can afford it. And I play tennis and pickleball and take dance lessons. And so I can get away with it. But clearly, I burn it up. See, probably because of all the activity I do, it'll turn into glycogen in my muscles because my blood work is normal. You know, I'm 39. No, I wouldn't believe that. But my blood work is all perfectly normal. I'm at 0 pills because I do the things I try to teach you. I'm not bragging. I wasn't always that way. My dad had a deli in New York City. What do you think I ate when I was a kid? Lousy food. But I'm still here, okay. I did have a bunch of acne though, and I'm sure it's because I drank a lot of milk. And very interesting. So you have to watch what you put on your fork. You got to look at it. You got to watch how you use your fingers. But let's get back to this paradigm here a little bit. So we have basic metabolic rate, AOL, activity of living. If you can use a stand-up desk, or take a walk, or play tennis or pickleball like I do, take a walk in nature when the weather's good, like I do if you have time. Okay, but if you can do a lot of these things at work, then you don't even have to go to a gym. The average factory worker running up and down, my God, he gets a lot of exercise. The darn trouble is I give talks to a lot of factories, and people have a lot of stress. Yeah, they live in fear, depression, family problems, whatever, because I found, and I'm so sad I could cry, 80% are smoking. Then one of them comes up to me at a fast food place where I go just for the coffee. I don't eat the food. And he says, incidentally, Doc, most of us drink too. Well, alcohol is destructive to the brain, to the body, to the liver, to the heart. 2 or 3 glasses of wine a week, okay, but the rest of it destroys the human body, okay? And someone told me the other day, which I thought, we talk about Alzheimer's disease, memory loss from diabetes, but I think we can, he said, why don't you try this term, Alzheimer's, okay? Alzheimer's, alcohol shrinks the brain. I saw it as a neurosurgeon. That fell off the skull, so don't become an Alzheimer, okay? We have Alzheimer's disease, and now we have Alzheimer's. And, well, it at least maybe helps us remember what I was speaking about there. So I think get the blood testing. So this paradigm, BMR, let's talk about the calories in food. If you eat something fatty, 96% will sit in your belly, your gluteus, 4 hours. Only 4% use up a metabolism of the food. If you eat vegetables, they're so full of water, so full of fiber. If you eat 1,000 calories of vegetables, maybe only 50% will be in your body. You lose the fiber in the stool, you lose the water through your kidneys. So you see the point? You see the point? So if you're eating a lot of fibrous foods, a lot of vegetables and fruits, 80% or so, maybe not much meat, 20% at most, your diabetes will be gone probably in a month, 90% of the time. Does that sound hard? Did I say diet? Did I say count calories? I mean, I like Weight Watchers, for example, but it's to a point. They're still allowing you to eat lousy food, but just a certain amount of it, they give it points. You notice how many points do they give to vegetables and fruit? 0. They get the idea. They get it. But the darn trouble is, to me, if you continue eating the lousy food, you get 30 points a day or something, whatever it is. They have in it addictive substances like sugar, certain kind of fats, and you remain addicted to that kind of food. You know what I mean? It's kind of like giving you Suboxone if you're trying to detox so you don't get the high from narcotics. They give that. No, there's a point to it. I'm not totally against it, but Suboxone is what a narcotic. You're still on a narcotic. So if you're still eating a lousy food and you only get 30 points, what it is, you're still a food addict, okay? You still didn't get over the problem. I know somebody that's doing that. She's lost significant weight, but she's been going it 5 years now because she's still not over the addiction of food. But some people, it's the best you can do, and I say to that. If you don't want to read and just do something simple, I tell you honestly, if you just ate the right food, you get rid of it. I like this book by Dr. Joel Fuhrmann, Eat to Live, quick and easy. Quick and easy. It's fast. There's breakfasts, lunches, dinners, and smoothies. Describes, shows pictures of them, the recipes, 15 pages that begin to read. If you were to follow this book, say a month or two, and that's the way you ate, and it's delicious food, believe me. I've made some of the recipes myself, and it's delicious food. In the smoothies, which I didn't always take, but now for a couple of years I have a smoothie every day because it meets my nutrient need. If you were to do that, I bet in a month you don't have type 2 diabetes. Remember, I said, call your doctor. I'm going to change the way I eat. My blood sugar is probably going to drop. You may need to reduce my insulin, or a lot of times you take away the oral medication. Goodbye, metformin. It could happen. So this is a great way that you could get rid of it like that. 30 days, I bet you don't have diabetes for most of the patients. Not all of them, but most of them. Even if you had it for a long time. I've got a patient or two who had the beginning of renal disease, stage 1 or 2 renal disease, and they did this, went away. That hasn't been well studied. I don't guarantee it, but it might be worth a thought. That hasn't been studied enough. Probably too much money to be made in that industry. But did they take stage 1 type 2 diabetics and applied the Fuhrmann way or the West Youngberg way or Mark Hyman's way? That hasn't been well studied, but be open-minded to it. I know of a patient that had fairly advanced kidney disease, and he started eating this way. They had to pull out all the tubes, and his kidney, he started peeing again, and his kidney problem started to go away. That hasn't been well studied, but I say be open-minded. Let's review the complications a little bit that you're trying to avoid. Remember, if you do this, you can probably add 25 years to your life, avoid 35 years of disability. I mean, what are some of the disabilities? I went to a funeral recently where a guy had both his legs amputated. The brother had a leg amputated. The minister giving the sermon was a sister, and she looked like she's diabetic. I know Mom died from type diabetes. All that was avoidable, preventable, stoppable. And I have some associating with them, so I told them about it. But they're blind, living in denial. So don't live in denial. Get the proper blood testing. Get the proper blood testing. Otherwise, this is your future. I want you to live to be 120. Yeah, we're starting a course at a church on Warsaw Street, the Destiny Church. Karen Stanton, a wonderful minister. We're going to teach preventing, stopping, reversing diabetes on a regular basis. You can find her on Kachmann Facebook, KachmannHealth.com, or her Destiny website. It's already done by Crystal Bush and her church, and also Carla Jennings, Summit Church. We're teaching these things. So the community is getting involved. People are stepping up to bat. But government, industry, public health needs to join us, because people will become healthy. Wonderful. Isn't that great? So this is done out of love for you guys. Follow us. Come to our meetings. Maybe get a sheet, a handout I have for stress reduction, type 2 diabetes, the path to it, the complications in the back, all things I hand out for free. So come up to me, give me a hug, and I'll try to help you. I give lectures at Lutheran Hospital, KachmannHealth.com. You can see the date. One next Monday, 7. That one is on the secret of the non-diet. No diet, just eating the right food. So namaste. We love you all. This will be on public access TV. And follow us. Look at my 500 YouTube TV shows, public access, that are on YouTube, Kachmann Health, and it's all free, all free. I do it for you, for the love of physician means doctor. I'm trying to be a doctor. We love you all. Thank you for listening.